Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT high resolution endodontic mode of the lower right quadrant. The area of interest is the lower right first molar. On the 3D rendering, we can see that the lower right first molar is an edentulous space. This is the mental foramen. Now I'm going to take you through each and every section of this tooth. On the transaxial section, this is the transaxial section, but before that, this is the sagittal view. On the sagittal view, which is going to be side to side, we can see that we've got the second premolar, the second molar, and we've got the second molar tilting. So there's going to be a bigger embrasure space for the restoration. But we've got adequate bone quality that we can see on the sagittal aspect. No pathologies can be observed. On the transaxial view is absolutely critical. The transaxial view is basically, or this is the coronal view, which is front to back. So this is the buccal cortical plate. This is the lingual cortical plate. The lingual fossa is not very deep. The bone quality is D2, which means very good thick cortical plate, along with very healthy cancellous bone can be seen. We are going to be placing an implant. We'll place a generic implant and then we let the doctor decide which brand she wants to use. But a generic implant will give you an ideal diameter and an ideal length for this particular edentulous space. But before we place the implant, this is the axial view. The axial view is top to bottom. And on the axial view, we can see that the ridge is slightly thinner, but as we're moving down, the ridge expands and the cortical plate gets thicker. The cancellous bone is there, and we're moving apically. We can see that this is a uniform ridge, ideal for implant placement. Now, this is the implant. We've placed the implant. This is a 4.1 diameter implant and a 10 mm in length. Now, whatever brand you use, a 4 mm diameter to 4.3 mm diameter should be ideal, and a length between 9 to 11 or 9 to 10 should be ideal in your scenario. Now, we're going to take you through each view on the 3D rendering. You can see that the implant has been placed and there's absolutely no implant thread exposure on the 3D rendering. If osteodensification bars can be used, that would also increase the width of the ridge and will also enable a thicker implant placement. But a 4.1 to 4.3 or a 4 mm implant can ideally be placed in this scenario. On the sagittal view, side to side, we can see that the yellow portion, which is the crown, and this is going to be a prosthetically driven implant placement. So the crown portion is center of the ridge. It will have adequate support on either side. On the implant fixture, we can see that the implant is surrounded by good quality, healthy bone. This white box that you see is basically the implant safe zone, so it's not invading any of the vital structures. The inferior alveolar nerve, the second premolar, and the second molar, they're all safe from the implant placement. Moving to um, the coronal view, we can see that the implant is placed right center of the ridge. It's got good cortical support on either side, and slightly deeper implant placement will also ensure even better cortical support from the implant. And from the axial view, we can see the implant is just center of the ridge, and this implant placement can be ideal if the placing doctor can use this virtual position for implant placement. So this is the CBCT. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.